One of the most common killers of women in America is something that you'll be surprised to hear, and it's osteoporosis. We think about breast cancer, right? We think about heart attacks. But did you know that when a lady has a hip fracture, 1 in 4 of those ladies will die within a year? Osteoporosis is a disease that everyone kind of knows about, we all kind of think about, but we don't think enough about it. It's an incredibly cruel disease that has incredible impact in both lifespan, people's ability to function well, people's ability to enjoy their life pain-free. Osteoporosis is a terrible disease. What most people don't know is that hormone replacement therapy will not just stop osteoporosis, but can cure it as well. Our hormones are responsible for maintaining our bone density. Did you ever wonder why women don't start to become osteoporotic until they're menopausal? The reason is because they've lost their hormonal support. When you lose the estrogen and testosterone are really the two that are most important for this. When you lose those hormones, you stop making new bone. And when you stop making new bone, eventually the bone gets brittle and thinner and more thin until eventually it just starts breaking. And that's the story of most women's lives when they're in their postmenopausal years. The wonderful thing is that with appropriate hormone therapy, you do not need to have osteoporosis. You don't need to break a hip. You don't need to have your back just shrink like this until you're all bent over and you look like a question mark. Those are diseases that occur because of loss of hormonal support. The medications we have for osteoporosis are frankly not that good. We can slow it down, but we can't stop it. But with hormone replacement therapy, you can absolutely stop it. And that is something that people don't think about. It doesn't come up first in people's mind when they think about hormone replacement therapy, but it's really, really important. And it's something that I feel very strongly about for all my patients. Like, they come to me because they want to look good in a swimsuit and have sex with their husband. I want to protect them from the diseases of aging. And osteoporosis is one of the worst of that, and we can protect people from that. And that's something that I find really meaningful for me as a physician.